Good morning. Coming up from Public Health, we have the spokesperson, Janela Carrera. And that was a little bit of Mariana's Collective. Freddie Berdalio, Gene Castro, and Joe Hernandez. Good stuff there, 923. From Public Health, Janela Carrera. Good morning, Janela. Thanks for joining us.
There she is.
Popping up here. Right on. Happy Monday.
Hi, good morning. Is it my turn?
It's your turn. Hello, welcome.
Right on time.
Well, thanks for joining us.
Good morning, everyone. Happy Monday.
Right
Happy
on.
Monday. I don't know if you heard May. She was on earlier, and I don't know if you had any other information to add to it. But she said it was a very somber weekend over at GMH only, that there were several fatalities that occurred over the weekend, and some of them were DOA. Do you have any other information regarding that, or?
I don't have information. We have yet to receive it, at least for the JIC report. I imagine we'll be receiving it possibly today to be able to report that out in the JIC release. Usually, obviously, anytime that is reported, the hospitals would receive it first and then relay it to the Joint Information Center for release into the public. So, yeah, wow, I can imagine how heartbreaking that is to learn about.
Right. I guess then an update on the FEMA team. Can you provide information on that? Are they here? Are they at the infusion center?
Sure. So my understanding is they did arrive. I believe most of them have arrived. There may be still some. I don't have an exact number on how many arrived, but I believe the first two arrived a couple nights ago, and then most of them arrived last night, and then there's still a few more that we're waiting for. So that's great news. They're here. Most of them, at least, are here. So, but prior to their arrival, we've already been doing Region Cove infusion, as you're well aware and have already reported, at the Manila Senior Center. So what's going to be great is that with them here, they can just do some orientation at the Manila Senior Center, see our operations, and then get right to work as well.
And speaking of the Regenco Cove, May was saying that a shipment arrived over the weekend, over 400, I believe she mentioned.
Yes,
so
that's correct.
Does that all go to Public Health, and then Public Health divvies it out? How does that work?
Right. So there was a physician's advisory that went out, I believe it was late last week, and that physician advisory basically just it lets our providers know that there's a change in process and procedure in the way that the Region Cove and monoclonal antibodies are ordered and distributed. So prior to that change, providers and clinics are able to provide or order directly from the manufacturer, but the Health and Human Services have changed that process so that now we have sort of one hub that places all those orders for monoclonal antibody, and then the distribution is through the state and territory, which in this case would be Public Health. And so it just kind of makes the process a lot more smooth and efficient that way, so there's no confusion. And there's one point of contact that the HHS would be dealing directly with, and then they also base it on our utilization rate. And so you're right. So over the weekend, late last week actually, we did receive a shipment of 480 Region Cove courses or doses. So they arrived in good condition, and so we'll be able to distribute that out to our providers, and then from there it goes out to all the patients.
Any of the Regenco been given to the private clinic so they can do the same?
I'm not sure if they've been divvied out to the private clinics yet. I don't know if we've actually had any providers that have reached out. I know that we did put a call out to providers if they're interested, if they have patients. Most of our referrals have been through our testing sites. And so when we do have patients that are eligible through our testing sites, they're referred to the hospitals or to the Minilao Senior Center. But as far as private clinics or providers, that I'm not sure yet if we've had any private providers reach out to us. I'll have to double check on that one.
Well, a lot of things have happened since Friday. Friday was the deadline for GovGov employees for the vaccinations. Today's the private businesses covered under the executive order. And then over the weekend, we saw the exemption forms approved and available online. And then there's the testing guidelines. Are you able to kind of just walk us through what exactly is in these testing guidelines, specifically for parents, so they know what these schools are going to be doing with their children?
Sure. So, there's two components for the testing guidelines, as you mentioned, with the school system. So first, so as not to confuse the two, the first component is there's a diagnostic portion. And that diagnostic portion really is a long-term plan. And that is anytime there is a child, a student, staff, or teacher who is symptomatic, we want to ensure that they are able to come to a school health counselor, nurse, or office and get tested immediately. If they test positive, then we can immediately isolate that individual, student, teacher, or staff, and case investigation is initiated. So that is a diagnostic portion. That's I think guidance memo 2021-26. And then the second component is the screening testing. And that portion or that component handles the plan that would have sort of a regular type of testing. I think if I'm not mistaken, it says a biweekly plan, and it gives schools time to sort of develop the plan up to 90 days to test 10% of the school population. So that in a nutshell is kind of the difference between the two plans, but they kind of go hand in hand. What we don't want to happen is that while the schools are developing in that 90-day time frame a screening testing component and testing 10% of their population at a frequency of every 2 weeks, that they miss out on finding or testing students and staff who are symptomatic. So at any given time, anytime there's a student or staff who's not feeling well and they come in and say, just as an example, they may feel symptoms, but perhaps they take their temperature and it doesn't register as a fever, even a low-grade fever, but they may have diarrhea or just fatigue, which could also be symptomatic of COVID-19, but they don't register as a fever. The nurse or an official might send them back to class, not knowing that might actually be COVID-19. But with the guidance in place, they can test them still for COVID-19. They may still end up testing positive. So with that guidance in place, and we have tests, kits available in the school setting, then we can immediately identify that positive case and isolate them.
And so these, everyone's that needs to be trained to administer these tests have been trained or will be required to undergo the testing?
That's correct. I mean, we do have nurses, right, at the DOE school setting. And also, I believe it was either late, sometime last week or the week before, we did have a training session for, I want to say over 100 or at least dozens of personnel from DOE to undergo how to administer these tests. So we ensured that they were equipped to learn how to test students at DOE settings.
Did it include guidance on like a waiver form, like for parents? Because I'm not sure if I'm comfortable with just anybody stuffing
my
a
understanding is,
Q-tip
at
up
least for the
someone's
screening
nose.
testing, I think DOE is still working on ensuring that there is some kind of approval or getting the parents to agree, right?
Is that part of it though, Janela? Is parental
I'm not
consent
sure if it's in
required?
I'm not sure if it's in the guidance, but I know that there's some kind of consent, at least for the screening testing, if that's part of the development that needs to be done under the 90-day timeline.
Is there an age group that would be required to undergo this testing for kids?
So I know that for the screening testing, I think the priority, right, the preferred priority would be the unvaccinated, but it doesn't exclude those who are vaccinated. I think the priority obviously falls on those who are unvaccinated, but if there are at least, and also for the diagnostic portion. For the diagnostic portion, it doesn't matter if you're vaccinated or unvaccinated. If you're symptomatic, we test you right away. But for the screening testing, and I think that's all part of the plan for the DOE schools to develop. Test 10% of your school population, but we would like for you to develop that plan within 90 days. Whether that includes, a portion of your school population, mostly of unvaccinated, but you want to include also vaccinated students, how you determine how many, what the percentage or the makeup of that 10% is. It's inclusive of both unvaccinated or unvaccinated. Perhaps it's 50% unvax, 50% vax, or a larger proportion. I think that's all part of the developing of the plan within those 90 days.
What if a parent says, no, I'm not going to give you consent?
So I think that's part of it. I think that's where DOE comes in, is trying to get consent from the parents. And if there is a parent that doesn't consent to it, then that's part of the policy that they need to develop.
Okay. Exemptions. Have you guys already gotten people applying since it went up over the weekend?
I have to check back, but I know that prior to the medical and religious exemptions, the forms being issued, we had over 100 religious exemption applications and about 55 or so medical exemption requests that were submitted. But since we released the forms, I haven't been able to talk to our team yet to see if we had an increase or more requests that were submitted over the weekend. So we had quite a lot that were submitted prior to the forms being officially released.
And we had the mayor on, and he was talking about there seems to be some confusion because they're part of this whole aggressive campaign to go out and reach out to their constituents to get tested. But then, lo and behold, some of them are saying, hey, when I went to the tier 2 clinics, they're charging me. They're charging me administrative fees, and they were under the impression that they would have to pay zero, that they wouldn't be charged anything. Can you provide, I guess, any clarification or anything to kind of address those concerns from residents that apparently want to get tested, but they also don't want to pay to get tested?
Yeah, so I know that that's been sort of an issue, right, with regards to private clinics. It's come up several times over the last year and a half. Some clinics do charge an administrative fee. I know that there may be some clinics actually that don't charge an administrative fee, and then there are also other clinics, depending upon your healthcare coverage, would be absorbed by whatever insurance you might have. But it is an allowable procedure or allowable policy for these private clinics to be able to charge you for a fee, an administrative fee, but the actual testing portion itself is not being charged. So the test itself is free, but the administrative cost is what's being billed. So the clinics are, and this was already determined by, I want to say CDC, is that the private clinics can charge an administrative cost. But that's the reason why public health and the government of Guam stands up these clinics, these outreach clinics rather, is what I wanted to say is that's why we have TIZN, we have the Northern Public Health, and we have Southern Region Community Health Center as well. So that for those who are unable to afford getting tested at private clinics, the ones that do charge an administrative fee, we have these clinics available. I know that, for some it may be an inconvenience because there may be longer wait times, but we try to do our best to make these available. And, I do want to thank our Mayor's Council, our mayors, for doing their best to promote this campaign. But, it is something that these private clinics can do, is charge an administrative fee.
Any word on whether or not there's any other infusion centers that are going to open?
And then on that, Janela, I know that when they opened this one, they said that they were able to service 10 patients an hour, but they anticipated being able to bump that up to 20. Are we close to that yet, or?
Right, up to 20. And what's great is now that we have our FEMA team arriving, hopefully that means we can, hopefully, I'm crossing my fingers, expand our operations. We did communicate with, I believe it was our southern mayors. We were eyeing that, the possibility. I'm not sure if it was in Alahan, but we were looking at that possibility. But what we determined was, initially we determined that it was Manila Mayor because it was more feasible. It was closer to TIZN, and it is a COVID positive, place, right? It's a place where we would be sending COVID positive patients. So as we look at our assets, we look at our resources, we look at our manpower, I think from there, we'll work with that. And if it's something that we can do as we move forward in terms of opening up more centers, I think that's what we can work with. For now, it's Manila Senior Center, but now that we're bringing in more assets, if we're able to do that, and just remember, the FEMA team is here on a temporary basis. If we're able to, and if it's approved, if we can put in a request to extend their mission here, then hopefully that's something we can do and it gets approved. But they're here initially, I think it's a 30-day mission. And so for now it's a senior center. And again, as I mentioned, we did initially look at Inalahan as a possible site, but Manila Senior Center was a better option. Yes.
Janela, where is public health as a agency with their vaccination compliance?
Vaccination compliance.
With the mandate, the vaccination mandate?
Oh, I'm sorry. You mean our rate? Last I checked, which was late last week, we're at about 89%. So, and prior to that, the week before that, we were at 86%. So it's going up. And, as I talk to more of our agencies, it goes higher. So there's a lot of them that are saying, a lot of us are just due this week, or we're due for a second dose. So as the weeks go by, as the days go by, more and more people are trying to catch up with their second dose. So it goes up, as the days go up as well.
What about planning for the administration of booster shots?
A great question. So, as you're aware, if you're following the news, the CDC actually so they just made a decision. The CDC director herself actually kind of went above and beyond what the ACIP had recommended. So we actually had a discussion just this past weekend, and so I believe the plan now is to have the VAPPC meet and discuss how we're going to have whether it's going to be in phases or whether we're just going to roll it out as is with how the CDC is basing it on. So hopefully we'll have a decision or an announcement made by today, and so the public is aware of how they can make the booster shot available to them.
Is the VAPPC or CCP, I forget, are they meeting this afternoon or today?
Yeah, hopefully it'll be today. My understanding is it will be sometime today.
Mm-hmm.
Any enforcement actions taken against anybody for violations of the governor's executive orders or COVID-19 protocols, Janela?
Actually, I don't know if you've been seeing the emails that I've been sending with regards to the enforcement, but most of the establishments have been very compliant. They've been pretty compliant. We haven't been seeing any violations occurring. So, we're really glad that they've been very cooperative when our team goes out to do inspections. They're not really running into any problems. We see we see complaints here and there, or people just reporting, this is what I'm seeing. But when we go out, I think some of it is just a misunderstanding on what they're seeing or perhaps what they're observing. But when we go out and we observe or when we go out to inspect, we get clarification on what's going on. And so most establishments, as you'll see in the reports, are complying with the mandates and the executive orders.
Mm-hmm. I did want to follow up on a story that we did last week, and a caller that called in to the show expressing, what happened to her family and issue she had trying to get a hold of public health, 311, trying to get into the isolation facility. We posted that story, and then the comments, there were other people who had similar nightmare stories about just trying to get into the isolation facility. So are you guys aware of this at all? And have you guys received any complaints about people being turned away?
I'm not aware of anyone being turned away, and nobody really should be turned away unless our isolation facility obviously is full. And even at that, we would do our best to try and assist. And I'm not aware of our isolation facility being full. I've not heard of it being at capacity. If we have beds available or rooms available, we will take them. We will endorse them if as long as we can assess the situation, and we can endorse them. Now, I think I'm familiar with the story that you're talking about because I do read the news, so I'm familiar with what happened. So I don't know specifically, what the case was with that particular patient. But, typically what we do is we advise patients who are in need of, if their home is not a suitable place for them to be able to isolate, then we advise them to contact 311, which is a standard. We always advise people to contact 311. If it's an emergency, contact 911. And our nurses who answer the 311 hotline can assess the situation and then endorse them to the isolation facility. Now, if they're unable to get a hold of 311, we also have the JIC call center as well, and they can also assist. But the isolation facility is capable of also endorsing them to the isolation facility if that's the situation. I mean, unfortunately, and I do want to extend, an apology to this particular patient and this family that for whatever reason they weren't able to get in. I don't know, I think I read your story, the story that the nurses told them that they were full. Was that the case? And then later come to find out we weren't full. I don't know why that happened. I'm not sure why. I'd have to find out and do further investigation, but I'm not aware of our facility being full, so I'd have to find out exactly why that was the case.
Has there ever been any discussion to open? Because I know a few months back they said, "Oh, we're going to do a hybrid facility or open another facility." Is that still in the works, or we scrap that?
I don't know whatever became of that. I know I recall that those were in discussions several months back, but at this point I think it's still status quo, and I don't know where those discussions have led to.
You're talking about the consolidated facility,
Yeah.
right? Yeah,
Right,
I did reach out
Okay.
to Jenna, and she said the bid for potential vendors has been announced, with the last day for questions being last week Friday. We do not have a list of vendors who picked up bid packets, so that was the status of that. And also, just for clarification, because we have had people that have called, and it's regarding when they go and they get tested and they're waiting for a clearance from public health on whether or not it was positive or negative. And even for those who are positive, these letters of clearance, do they have to wait for a phone call, or did they just automatically go to public health in Agania and pick up these letters of clearance?
So the clearance letters, when we were doing the isolation clearance letters, I know that there were a couple of weeks that we were doing that here at our office in Agania. So we actually discontinued doing that. So we did make an announcement that if they need an isolation clearance letter, they can actually submit a request through email. And I believe the email address is covidresults@dphss.guam.gov. So if they need their isolation clearance letters, they can send an email request to that email address. And so the particular service that we were doing for the actual pickup at that time was because we did have a backlog. And so we had like over 600 or 800 letters at the time where they can, and we weren't able to dole out all of the letters. And it was just too much letters to be able to have it all picked up. So we decided we'll just have a service where people can come and pick it up. But we were able to finally bring that number down to a manageable level. And so now we can do it via email. Now, for those who are in isolation, we are, at this time we are, especially in August, we experienced a surge, and the numbers are still continuing to go up. We have a lot of people in active isolation. And so our contact tracing team, our case investigation team is doing their best to manage, people, trying to get in touch with people to ensure that they are, being monitored, even those in quarantine being monitored. And so that's why we advise people that if you do test positive, the best thing to do is to just remain in isolation. Keep yourself at a safe distance from others in your home. If you are a close contact, of course, also self-quarantine, and try to stay away from the person that is a positive case. Now, for your isolation, the standard is 10 days of isolation. If you clear isolation on the 10th day, as long as you're not experiencing worsening symptoms, and you're no longer taking any fever-reducing medication, and it's been 24 hours since you've had to take fever-reducing medication. And so if all of those have been met for your active isolation, then you can request for an isolation clearance letter if you need one. Say, for example, you need to return to work or school. So those are the standards that we've been trying to communicate to the public. Usually public health, the case investigation team, will contact you during those 10 days to monitor you. I know that there have been situations, and we've been getting some feedback from the community stating that, nobody's contacted me, or it's been more than 10 days I haven't been contacted by public health during, my active isolation period. But we are doing our best because there are, thousands of people in active isolation, and we really have a very minimal team of case investigators. And so that's part of the reason why we're asking the community to also work with us, that if you are positive, these are the steps that you should take in the meantime. So we are trying to come up with a better system to improve it, but we also ask the community to work with us. If you're positive, just isolate yourself. If you're a close contact, quarantine yourself. If you're fully vaccinated and then you're not considered a close contact, but you should also get tested within 3 to 5 days just to make sure.
And I just had one more question about the COVID alert app. Is this still working?
It does work. It does still work. I actually tested it just to make sure. I wasn't positive, but I entered a code and I wanted to see, and I didn't tell my family because I didn't want them to expect an exposure notification. So my daughter and then my son, they were like, hey, my sister, they were like, oh my God, I got an exposure notification. And I said, don't worry, that was just me. That was me testing the exposure notification. So it does work. But what needs to happen is people around you and people in general need to have the app in their phones downloaded. And then the Bluetooth needs to be turned on. And then, of course, you have to be within 6 feet, 15 minutes of exposure. Your phones need to be in order for it to work. So, and then whoever's positive, if somebody turns up positive, they need to enter a code into their phone. That's how the system works. So it's not an automatic thing. If somebody turns up positive, they need to get a code from public health, enter that code, and then those around you within the last 14 days, if they have the app downloaded to their phones, will receive that exposure notification. So it is still working. I just tested it last week.
But you got to have it, and you got to report your status.
Right. Exactly.
You good?
All right. Yeah. Thanks, Janela.
No further questions.
You're welcome. You're welcome. Thank you, guys.
Thank you.
Take care.
All right. Have a good week.
Take care. You too. Bye.
All right. We're going to take a quick break and come back and close out the show next. Good morning.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our part, including our children, to hold the line. You can protect yourself and your family by getting vaccinated.
And if you're already vaccinated, don't let your guard down, because you can still give and get COVID-19. And if you're not vaccinated, remember that if you catch the